12 warning signs of blood clots. Blood clots are silent threats that can lead to severe health complications if not detected early. These clots, which can form in veins, such as deep vein thrombosis, DVT, or in the lungs, resulting in pulmonary embolism, PE, are potentially life-threatening conditions. Early detection is vital to prevent devastating outcomes. Blood clots are responsible for over 100,000 deaths annually in the United States alone. Despite being treatable, delayed recognition of the symptoms often leads to complications. Today, we'll uncover the top 12 warning signs of blood clots, giving you the knowledge to protect yourself and loved ones. A quick note, I'm not a doctor, and this video is intended for informational purposes only. Now, let's get started. Number 1 is swelling in the leg or arm. Unexplained swelling in one leg or arm, particularly without injury, can indicate a blood clot. This swelling is usually localized, making one limb appear significantly larger than the other. Deep vein thrombosis, DVT, is often the underlying cause. DVT occurs when a clot forms in a deep vein, commonly in the legs, blocking blood flow. Alongside swelling, you may experience tenderness, redness, or a sensation of warmth in the affected area. Extended immobility, such as sitting during long flights or bed rest after surgery, significantly increases the risk of this condition. The swelling may feel tight, and the skin might even appear shiny. While swelling can have other explanations, like injury or infection, when combined with other symptoms, it's a warning sign of a possible blood clot. Next, we have pain or tenderness. Persistent pain or tenderness, especially in the calf or thigh, is a common sign of a blood clot. Unlike muscle soreness from exercise, this pain does not improve with rest and may even worsen over time. It often feels like a cramp or a dull ache that intensifies when walking, standing, or pressing on the area. Blood clots in the deep veins cause inflammation and pressure, which lead to this discomfort. While pain alone might not seem alarming, when paired with swelling or discoloration, it becomes a red flag for DVT. This symptom is especially concerning if you've recently been immobile or had surgery. Number 3 is skin discoloration, red or blue. Changes in skin color, such as redness or a bluish tint, can signal a blood clot. The affected area might also appear pale or shiny. Redness is often a result of inflammation near the clot, while a bluish hue indicates restricted blood flow. This discoloration is typically localized, appearing in the leg, arm, or another area where the clot has formed. You might also notice other signs, such as swelling or tenderness, in the same region. Blood clots cause veins to become inflamed, which is why the skin around them changes color. In some cases, the area may feel warm or tight, adding to the discomfort. These visible signs should not be ignored, as they often indicate a serious condition like DVT. Now let's talk about warmth in the affected area. An unusual sensation of warmth in one specific area of your body can indicate a blood clot. This warmth is often localized, occurring over the area where the clot is situated. It may feel as though the skin is heated compared to the surrounding areas. This symptom arises because blood clots trigger inflammation in the vein, causing the body's immune response to send extra blood flow to the affected region. Alongside warmth, you might also notice swelling, redness, or tenderness. These symptoms combined can strongly point toward deep vein thrombosis, DVT. While a warm sensation could be caused by other factors, such as an infection or injury, its persistence alongside other warning signs should prompt concern. Number 5. Shortness of breath. Sudden shortness of breath is one of the most alarming signs of a pulmonary embolism, PE. This life-threatening condition occurs when a blood clot from elsewhere in the body, often the legs, travels to the lungs and blocks a pulmonary artery. Shortness of breath from PE may come on abruptly, and it can worsen with physical activity or even while at rest. It often feels like you're unable to catch your breath, regardless of how deeply you inhale. This symptom may be accompanied by a racing heart, chest pain, or coughing, potentially with blood-streaked mucus. Reduced oxygen levels in the blood due to PE can also cause dizziness or fatigue. Shortness of breath is always a medical emergency, particularly when it occurs unexpectedly. Next is chest pain. Sharp or stabbing chest pain is a serious symptom that may signal a blood clot in the lungs, pulmonary embolism, or heart. Unlike the dull ache of muscle strain, this pain often intensifies with deep breaths, coughing, or physical exertion. Pulmonary embolism occurs when a clot obstructs blood flow in the lungs, leading to a lack of oxygen and pressure buildup. Chest pain might be accompanied by rapid breathing, a fast heartbeat, or lightheadedness. In some cases, blood clots in coronary arteries can lead to heart attacks, presenting with similar chest discomfort. It's crucial not to ignore any chest pain, particularly if it occurs alongside other symptoms like shortness of breath, sweating, or nausea. Number 7 is rapid heartbeat or palpitations. A sudden rapid heartbeat, or feeling like your heart is racing, can be a warning sign of a blood clot. This symptom often occurs when a clot obstructs blood flow in major arteries, forcing the heart to pump harder to compensate. Palpitations may feel like fluttering, pounding, or skipping beats, and are often accompanied by other symptoms like chest pain, shortness of breath, or dizziness. Blood clots in the lungs, pulmonary embolism, or heart can trigger these symptoms, sometimes causing atrial fibrillation, AFib, a dangerous irregular heart rhythm. If you experience palpitations that are unexplained, prolonged, or severe, especially with other warning signs, it's essential to seek medical attention. Left untreated, blood clots can lead to serious complications, including heart failure or stroke. Number 8. Dizziness or lightheadedness. Feeling lightheaded or dizzy, especially if it occurs suddenly, may indicate a blood clot. This symptom often arises when a clot disrupts blood flow to critical areas, like the brain or lungs, leading to reduced oxygen delivery. Pulmonary embolism, PE, can lower oxygen levels in the blood, causing faintness, confusion, or even loss of consciousness. Blood clots in the brain can also result in lightheadedness, sometimes paired with blurred vision or difficulty concentrating. This symptom might be more pronounced when standing up or after exertion. While occasional dizziness can result from dehydration or low blood sugar, persistent or severe episodes warrant medical attention. Next on our list is swelling in both legs. When both legs become swollen, it may be a less common but serious indicator of a severe blood clot. This type of swelling often suggests a clot in a larger vein or a deep vein thrombosis, DVT, affecting the pelvic area. The swelling may be accompanied by feelings of heaviness, tightness, or pain. Unlike minor swelling caused by sitting or standing for too long, this swelling doesn't resolve with rest or elevation. Bilateral swelling can also make the legs feel unusually warm or appear discolored with redness or a bluish tint. It's important to note that blood clots causing swelling in both legs can be life-threatening, as they often lead to pulmonary embolism if left untreated. Number 10. Redness on the skin. Unusual redness on the skin, especially along a vein, can be an early indicator of a blood clot. This redness might appear as streaks or patches and is often accompanied by swelling, tenderness, or warmth. The inflammation caused by the clot can make the skin in the affected area look shiny or tight. In some cases, redness may extend along the path of a vein, signaling a condition known as thrombophlebitis. This inflammation occurs when a clot partially blocks a vein, causing irritation and increased blood flow to the area. While redness can result from other issues like infections, the presence of other symptoms like pain or swelling strongly points to a clot. Number 11 is sudden weakness or paralysis. Abrupt weakness or paralysis on one side of the body is often a significant warning sign of a blood clot in the brain, leading to a stroke. This weakness may affect the face, arm, or leg, making it difficult to smile, lift an arm, or walk. Paralysis often occurs without warning and is usually accompanied by other symptoms such as slurred speech, confusion, or vision problems. Blood clots block oxygen-rich blood from reaching brain tissues, causing rapid cell death and loss of function. Immediate medical intervention is crucial, as delays can lead to permanent disability or death. The last on our list is confusion or difficulty speaking. Confusion or difficulty speaking, such as slurred speech or trouble understanding others, can signal a blood clot in the brain. This symptom, often associated with stroke, occurs when a clot restricts blood flow to areas responsible for language and cognition. The result may include garbled or nonsensical speech, difficulty finding words, or an inability to form coherent sentences. In severe cases, confusion may be accompanied by memory lapses or disorientation. Aphasia, the medical term for impaired speech, is a common consequence of blood clots causing brain damage. If you or someone you know experiences any of these symptoms, don't wait. Seek medical attention immediately. Blood clots are treatable if detected early, but delaying care can lead to devastating outcomes. Share this video to raise awareness and help others recognize these critical warning signs. Together, we can save lives.